Teleflex is a medical device firm navigating a major corporate split, balancing a legacy portfolio against a strategic pivot to higher growth therapeutic areas. Teleflex is a global provider of single-use medical devices, primarily serving hospitals and healthcare providers. The company is headquartered in Wayne, Pennsylvania, with significant operations across the Americas, EMEA, and Asia. Teleflex is positioned as a key supplier in vascular access, interventional, surgical, and acute care markets. In vascular and interventional, Teleflex offers products like Aero central venous catheters, peripherally inserted central catheters, EZ-IO, GuideLiner, Manta, and new Biotronic balloons and stents. In surgical, the company provides WEC Hem-o-lok ligation and Titan SGS for GERD. In urology and acute care, Teleflex features UroLift for benign prostatic hyperplasia, Barrigel prostate spacer, LMA airways, and QuikClot hemostatic agents. The company also has an OEM segment focused on precision manufacturing for other device companies. Teleflex makes money primarily through sales of single-use, disposable products, which account for 92% of total revenue. The business model relies on strong group purchasing organization contracts and broad portfolio access. The company is shifting from tools to higher-margin therapeutic devices like Biotronic and Barrigel. The company is undergoing a corporate split, separating into RemainCo, which will focus on vascular, interventional, and surgical, and NewCo, which will focus on urology, acute care, and OEM, targeted for 2025 to 2026. The Biotronic acquisition expands Teleflex into coronary and peripheral interventions and boosts its presence in EMEA. The company is also consolidating manufacturing from 19 to 7 plants to improve margins. Teleflex faces headwinds, including China's volume-based procurement pricing pressure, Italian payback policies, and rising ethylene oxide sterilization costs. Strengths for Teleflex include market leadership in core franchises like Aero and EZ-IO. RemainCo is targeting gross margin expansion above 60% post-split. There are expected synergies from the Biotronic acquisition and international sales growth. Barrigel is gaining share, with a goal of 25 to 30% by 2026, and UroLift is on a recovery path. Risks include intense competition from giants like Medtronic, BD, and Boston Scientific. There is execution risk on the complex corporate split and Biotronic integration. The company faces persistent pricing pressure from group purchasing organizations and policy risks in China and Italy. There are also supply chain vulnerabilities and cost inflation from ethylene oxide sterilization. Key items to watch are the execution of the company's split, the successful integration and ramp-up of Biotronic, and the adoption trajectory of Barrigel against the recovery of UroLift.